Latest developments, big developments, and the big number we're keeping an eye on today. What is that number? 33.8 million. That is the number of Americans that now identify as multiracial. That's according to the latest census numbers. That's up 276% from 10 years ago. So we are sitting at a time, and maybe it makes sense, but we are the most diverse we have ever been as a nation right now.
That's remarkable. I love that number. Very cool. Unfortunately, numbers that we aren't very excited about are the COVID numbers that we're seeing. Obviously, this Delta variant sweeping across the country. So we've been talking about the state of our hospitals and some of these COVID-19 hotspots, especially down south. What is going on behind the scenes?
So when people hear hospitals at capacity in states like Florida and Texas and Mississippi, you have to understand really four elements at place when we talk about that. And they're the four S's: staff, space, supplies, and systems. So in terms of staff, I'm talking to friends, relatives, colleagues who are telling me that they are experiencing burnout, overt PTSD, anger and frustration, that so much of this is preventable, and definitely fatigue, mental and physical. In terms of space, when you hear ICU beds at full capacity, there are no spaces, that puts everyone's health at risk. You can't just care for a critically ill patient in any part of the hospital. And then systems. There are teams required to care for these patients. Ventilators don't care for a patient on their own. You need respiratory therapists. Those systems are also stressed. Right now, the good news, we don't really have an issue with supplies, but when you look at hospitals at capacity or underwater, these are the issues that those administrators and staff are dealing with, and it is a major crisis.
Okay, does it come with a major cost?
Oh, it absolutely does. And to be clear, the biggest cost is that it endangers people's lives. But then when you look at other costs, you're talking about financial, obviously, both direct and indirect. So yes, it costs the patient, but to be clear, it costs all of us as well. And then for other people, there's a delay in all kinds of other healthcare services, elective, routine screening services. Physically, there are short-term and long-term risks to COVID-19 for the patient. And then again, care is being diverted from everyday emergencies that still occur, car accidents, heart attacks, strokes, to deal with COVID-19 patients. And this is a largely preventable situation.
Dr. Ashton, we appreciate you as always.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.